Hello, thanks for joining us today. I'm Dr. Wanda Barfield, Director of CDC's Division of Reproductive Health, and I'm pleased to be here and speak with Allyson Felix, U.S. track and field star and Olympic athlete and proud mother of an adorable little girl.
Hi, thank you so much, Dr. Wanda.
So, as a mom myself, I understand that some of the challenges that can come with pregnancy. I actually had a complication myself and went into preterm labor at about 28 weeks. And I think that we both feel very fortunate that we've been able to use our voices to make people aware of the risks that are associated with pregnancy and the importance of recognizing those warning signs. You've done so much wonderful work promoting maternal health and raising the awareness of racial disparities that exist among women of color. And I'd just love to talk a little bit about your story and why maternal health is so important to you, particularly for Black women. And I was wondering if you could maybe share a little bit about your experience with preeclampsia.
Yeah, for me, I had a really great pregnancy. Being an athlete and knowing that I was coming back to train, I exercised throughout my pregnancy. I felt strong and I felt great. And I felt, really blessed to do well. And then at 32 weeks, I went in for, a very routine appointment. And that's when I was immediately sent to the hospital for further testing and later admitted. And that's when I found out that I was suffering from preeclampsia. And things moved very quickly, very fast. And we got into a really scary situation. And I think just going through all of that and being able to come out on the other side of it, I feel so blessed and so fortunate. But as I look back through those really terrifying moments for myself and my family, my eyes were just open to a whole nother world. And I think I knew the statistics that I knew, what some Black women had faced, but I didn't know how at risk I was. Knowing that I'm a professional athlete and that I'm healthy and I've lived all of my life, doing all of the things to keep my body healthy. I never imagined that I would be in this situation. And so it was completely a situation I just never would have thought that I would have been in. And so going through all of that, it just made me have a heart, for my sisters and just want to bring awareness. And I just knew, the things that could have helped me. If there's any small thing I could do to help, the next woman facing that, then I definitely wanted to do that.
Well, thank you so much for sharing, Allison. Just to share with everyone, for those of you who may not be familiar with preeclampsia, preeclampsia is high blood pressure and signs of liver and kidney failure that include protein in the urine and can even occur with very serious complications. And it usually occurs with women after the 20th week of pregnancy, and it can affect both the mother as well as the unborn baby. And early recognition of preeclampsia is so important. And we're so happy that you and your daughter had the opportunity to be detected early and that you're both surviving and thriving. And I really appreciate what you're saying in terms of this being a bit of a surprise to you. And the Hear Her campaign is really an opportunity to encourage women to speak up when they have those concerns, because there are circumstances in which women do have concerns and they are unable to be heard. And so we want to raise awareness about the very serious warning signs that can occur related to pregnancy. And we also know that unfortunately, there are too many women who die each year from problems due to pregnancy related complications. And it really doesn't have to be this way. And these problems can occur even up to a year after pregnancy. That's something that maybe people don't quite understand. And it's really important for pregnant women and new moms to be able to have support and be heard, not only from friends and family, but also from healthcare providers. And for me, as a mom of two, I feel really fortunate. I feel really blessed that I have a great support network. I have my husband, I have extended family, we have what we call our network. Can you talk a little bit about your support systems and how that's helped you during this time?
Yeah, I feel really blessed as well, that I have had really strong support from my family, from my partner, and even, looking back at going through such a scary situation in giving birth, having my partner there to make some of those decisions for me, that I didn't really understand how serious things were, and being able to lean on someone else and make some of those deciding factors is so important. I think for a lot of women, even going into thinking about what type of delivery they are going to have, I think we all, well, I know for myself, I wanted this beautiful natural birth and I imagined what it would be like. And I think I wish I would have been more open and understood that, birth can go in a number of different directions and you have to kind of be prepared for what that may come. And I think it would be helpful to have kind of a plan in place and, something, if everything goes south, this is the person who's going to be right here with me and to be helping me. And also just understanding the resources that are available. And, maybe that looks like having a doula or, some of
Yes.
these ways that we can educate ourselves to be prepared and to be best equipped for the situation.
Yes. So the next thing I want to talk about a little bit, and I want to thank you now just for emphasizing how it's important that everyone really help pregnant and postpartum women in terms of pregnancy complications. But one issue in particular is racial disparities. And I was just wondering if you can tell us why, particularly as a Black woman, you feel so passionate about improving maternal health in our country, particularly for Black women.
Yes, for Black women, just the studies that have been done and what we're understanding is that many times Black women's pain is not perceived as real. And we're not heard, as much as other women. And I think a lot of times, you go into a doctor's office and you can be intimidated. Obviously, they're a medical professional, this is their field, they're experts. And it can feel like, if you raise a concern and it's not heard, it's hard to keep pushing. But you have to do that. You have to be prepared to advocate for yourself. And I think it's very unfortunate that a lot of times there is this implicit bias in the medical field, but it is a reality and we have to be ready for that. And so I think just the awareness of, knowing what signs to look for and knowing that we're at risk. And so we have to understand that. And if something doesn't feel right, you have to bring it to the forefront and not let go of that. And I just think back, to finding out that I was pregnant and, not really paying attention that I was at risk or not knowing what to look for and, what is out of the ordinary. So I think those are things that I want, all women to know, but particularly Black women who are at a greater risk.
Yes, what you're saying is really important, particularly since we know that factors that might typically protect um, don't necessarily protect Black women. So, for example, having a higher education, our higher socioeconomic status does not necessarily seem to make a difference for Black women. In fact, Black women with a college degree still have higher rates of pregnancy-related deaths than white women without a high school education. And so we know that there are these serious differences. And, we may say, well, why is this? And we need to first do better as a society in terms of really addressing racial disparities in pregnancy related deaths and really take some real steps. We also know that these differences are not genetic. I mean, that there isn't anything inherent in the DNA of Black women that put them at increased risk. But what we do know is that there are factors that affect the environments in which we are born, where we live, where we play, where we learn, and where we age. And these are social determinants that can either affect us positively or affect us negatively. And we really need to understand that there are also other factors like the variation in quality of care, factors in terms of the burden of chronic disease, as well as issues such as racism, discrimination, as you mentioned, implicit bias. And these really do affect these differences.
Yeah.
So, Allison, I really appreciate you being here today. And I know that you're really very busy training for the upcoming Olympic Games. And we just want to wish you all the best of luck. And just to wrap up, what messages would you have for pregnant women and new moms and those that support them?
Yeah, well, I just thank you for having me to talk about such an important issue. And I guess my message to new moms, expecting moms, is just to be aware. I think to know signs to look for and to speak up. Not to be intimidated, but to always bring forth when there is an issue, when something doesn't feel right, and to make yourself heard. And sometimes that can take more effort, than we would like, but it is so important and it can really be the difference. In my whole situation, I feel so blessed to have walked out of the hospital and to have my daughter with me. And I know so many women who haven't been able to do the same, surviving partners and children, without their mothers. And, I just want us all to be able to do better so that that won't be the case moving forward.
Well, Allison, I just want to thank you again so much for your time. I want to emphasize that everyone has a role to play in improving maternal health and preventing pregnancy-related deaths, and recognizing the important maternal warning signs, getting accurate and timely diagnoses and quality care can really save lives. And I just want to tell the audience to please visit www.cdc.gov/hear her to learn more. Thanks, everyone. And thank you, Allison.
Of course, thank you.